Dr. Emily Hart here, and today we're going to talk about something that might surprise you. Medical tests that you may not need after turning 70. Now, I know what you're thinking. More tests mean better health, right? Actually, that's not always the case. As we age, our bodies change, and so should our approach to medical testing. Some tests that were crucial in your 50s and 60s might actually do more harm than good once you hit 70. Today, I'm going to walk you through 5 medical tests that you should seriously question with your doctor after age 70. And more importantly, I'll explain why. Let's start with something that might shock many of you. Routine cancer screenings. Now, before you close this video thinking I've lost my mind, hear me out. I'm talking specifically about certain cancer screenings that have been pushed as necessary for everyone, regardless of age or health status. The reality is that after 70, the risks and benefits of some cancer screenings shift dramatically. Take breast cancer screening, for example. For decades, we've been told that annual mammograms are essential for every woman. But here's what the research actually shows. For women over 75 with no symptoms and no high-risk factors, routine mammography screening may cause more anxiety and lead to more unnecessary procedures than it prevents deaths. Why? Because many cancers detected in older adults grow so slowly that they would never cause symptoms or death during the person's remaining lifetime. We call these overdiagnoses. You end up getting biopsies, surgeries, radiation, or chemotherapy for cancers that would have never harmed you. The emotional toll, the physical recovery, the side effects, all for a cancer that was never going to be a problem. The same principle applies to prostate cancer screening through PSA tests in men over 70. The prostate-specific antigen test has been controversial for years, and major medical organizations now recommend against routine PSA screening in men over 70. Studies have shown that the harms often outweigh the benefits. Many men end up with biopsies, treatments that can cause incontinence and erectile dysfunction, all for cancers that grow so slowly they would never have impacted their quality of life. Now, I want to be crystal clear here. I'm not saying that if you have symptoms, a family history, or your doctor has specific concerns, you shouldn't get screened. What I'm saying is that routine, automatic screening, without considering your individual health status, life expectancy, and personal preferences, needs to be questioned. Moving on to our second test, the annual comprehensive metabolic panel and complete blood count when you're feeling perfectly fine. Yes, I'm talking about those routine blood tests that many doctors order every single year during your annual physical. Here's the thing. If you're 75, you're on stable medications, you feel great, and you had normal labs 6 months ago, do you really need another full panel? Probably not. The issue with over-testing is something called the false positive problem. When you run dozens of tests, the odds are high that something will come back slightly outside the normal range, even when nothing is actually wrong. Laboratories set normal ranges based on where 95% of healthy people. So what happens when your potassium comes back slightly low or your liver enzymes are minimally elevated? More tests, more doctor visits, more anxiety, maybe even unnecessary treatments or procedures. And for what? In most cases, these minor abnormalities mean absolutely nothing, especially in older adults where reference ranges might not even be appropriate. Now again, let me clarify. If you have symptoms, if you're starting a new medication, if you have a condition that needs monitoring, then yes, targeted blood work makes perfect sense. But the shotgun approach of testing everything annually just because you turned another year older? That's worth questioning. Test number 3 might be even more controversial. Bone density scans after you've already been diagnosed with osteoporosis and started treatment. The DEXA scan, or dual energy X-ray absorptiometry, measures your bone mineral density. It's useful for diagnosing osteoporosis. But here's where things get murky. Once you're on treatment for osteoporosis, how often do you really need repeat DEXA scans? Many doctors order them every year or two, but the evidence suggests this might be excessive. Bone density changes very slowly. It can take 2 to 5 years to see meaningful changes, and here's the kicker. The repeat scan results rarely change your treatment plan. If you're tolerating your osteoporosis medication well and you're not having fractures, does it really matter if your bone density improved by 2% or stayed the same? Not really. You're going to continue the same treatment either way. What does matter? Whether you're having fractures, whether you're taking your medications, whether you're doing weight-bearing exercise and getting adequate calcium and vitamin D. Those factors are far more important than a number on a DEXA scan. Yet many older adults find themselves getting these scans repeatedly, often paying out-of-pocket costs, experiencing anxiety about the results, and ultimately getting no change in their management. The major medical guidelines actually recommend spacing out DEXA scans to every 2 to 5 years in most treated patients, not annually. Yet many patients and even some doctors don't know this. Now let's talk about test number 4. Stress tests for heart disease in people with no symptoms. Cardiac stress testing, whether it's on a treadmill or with medication and imaging, has become incredibly common. But if you're over 70, have no chest pain, no shortness of breath, no concerning symptoms, and you're not about to undergo major surgery, you probably don't need a screening stress test. Here's why. These tests are designed to detect blockages in your heart arteries. But detecting blockages isn't the same as preventing heart attacks. Multiple large studies have shown that in people without symptoms, finding blockages and stenting them doesn't reduce heart attacks or extend life compared to just taking medications like aspirin, statins, and blood pressure pills. Plus, stress tests have a significant false positive rate, especially in older adults. You might have an abnormal result, even though your arteries are fine, leading to more invasive tests like cardiac catheterization, which carries real risks including bleeding, kidney damage, stroke, and even death. Fall. That means 5% of perfectly healthy people will have an abnormal result on any given test, just by chance. Think about it this way. If you're feeling fine and a test comes back abnormal, you're probably going to end up with an invasive procedure that wouldn't have been necessary. And if the test is normal, well, you knew you were feeling fine anyway. The test didn't change anything. Now, if you're having symptoms, that's completely different. Chest pain, unusual shortness of breath, feeling like you might pass out. Those are reasons to get evaluated. And if you're about to have major surgery, a stress test might be warranted depending on your risk factors. But as a routine screening test in someone who feels perfectly well, the evidence doesn't support it, and the major cardiology societies have moved away from recommending it. Finally, test number 5. Colonoscopy for colon cancer screening after age 85. This one often surprises people because colon cancer screening has been so heavily promoted, and for good reason. Colonoscopy saves lives when done at the right ages. But there's a point where the risks start to outweigh the benefits. Most guidelines recommend stopping routine colon cancer screening between ages 75 and 85, depending on your prior screening history and overall health. Why? Because colon cancer typically takes 10 to 15 years to develop from a polyp. If you're 85 and you had a clean colonoscopy at 75, the odds that you'll develop a life-threatening colon cancer in your remaining years are quite low. Meanwhile, colonoscopy in older adults carries increased risks. The bowel prep can cause dehydration and electrolyte imbalances. The sedation is riskier. The perforation rate, while still low, is higher than in younger people. And if a polyp is found and removed, the bleeding risk is increased. What often happens is this. An 87-year-old gets a colonoscopy, a polyp is found and removed, bleeding occurs, the person ends up hospitalized, develops pneumonia or a blood clot, and a cascade of complications follows. All to remove a polyp that probably would never have caused cancer during that person's lifetime. The key question you should ask your doctor is, given my overall health and life expectancy, am I likely to live long enough to benefit from this test? If you're 85 but you have heart failure, diabetes, kidney disease, and you're already struggling with daily activities, a colonoscopy is almost certainly not going to help you live longer or better. But if you're 85, you run marathons, all your parents lived to 100, and you've never had a colonoscopy before, then maybe it makes sense. It's not about age alone, it's about individualized decision-making. So what's the common thread here? All of these tests share something important. They're examples of medical care where more isn't always better, especially after age 70. The principle we're really talking about is something called overdiagnosis and overtreatment. As we age, our priorities should shift from simply adding years to our life to adding quality to our years. Every medical test should pass a simple threshold. Is this test likely to find something that we would treat differently? And would that treatment actually make me live longer or feel better? If the answer is no, or if the answer is we don't know, then you should seriously question whether you need that test. Here's what I want you to do after watching this video. Make a list of all the medical tests you've had in the past year. Then, for each one, ask yourself and your doctor these questions. Why am I getting this test? What? These are not disrespectful questions. These are empowering questions. You have every right to understand why something is being recommended and to participate in decisions about your own body. A good doctor will welcome these questions and will be able to give you clear, evidence-based answers. If your doctor seems offended or dismissive, that might be a sign that you need a different doctor, one who practices shared decision-making and respects your autonomy. I also want to address something important. Some of you might be thinking, isn't this rationing care? Aren't you saying older people don't deserve medical attention? Absolutely not. What I'm advocating for is smarter care, not less care. I want you to get the tests and treatments that will actually help you. I don't want you wasting your time, money, and health on tests that are more likely to harm than help. There's a huge difference between appropriate medical care and excessive medical care. Excessive testing creates what we call the cascade effect. One unnecessary test leads to another, then a procedure, then a complication, and before you know it, you're trapped in the medical system dealing with problems that never needed to exist in the first place. Let me share a real example that I see far too often. A 78-year-old woman with no symptoms gets routine blood work. Her calcium is slightly elevated, probably meaningless, but it triggers a parathyroid workup. That leads to imaging that shows a tiny nodule on her thyroid. Now she needs a thyroid biopsy. The biopsy shows some atypical cells, not cancer, but not completely normal. So she gets surgery to remove half her thyroid. After surgery, she develops complications, ends up on thyroid medication for life, and goes through months of fatigue and recovery. All because of a routine calcium level that was barely elevated and probably meant nothing. This is not a rare story. This happens every single day in medical practices across the country. So here's my challenge to you. Be an active participant in your healthcare. Just because something is offered doesn't mean you have to accept it. Just because a test exists doesn't mean you need it. Medicine has become incredibly good at finding abnormalities, but we're still figuring out which abnormalities actually matter. After 70, Your healthcare should be personalized to you, your specific conditions, your goals, and your values. Not everyone's goal is to live as long as possible, regardless of quality of life. Some people prioritize comfort, independence, and avoiding medical interventions. Those are completely valid priorities, and your medical care should reflect them. Before I wrap up, I want to emphasize one more time. I am not telling you to refuse all medical care or to never get tested for anything. What I'm saying is to be thoughtful, ask questions, and make sure that every test you undergo has a clear purpose that aligns with your goals. If you have symptoms, get them evaluated. If you have risk factors that warrant closer monitoring, then monitor them. But if you're feeling well, will we do differently based on the results? What are the risks of the test itself? What happens if I don't get this test? Could an abnormal result lead to more tests or treatments that might be worse than the original problem? The 5 tests we discussed today, routine cancer screenings after a certain point, excessive blood work panels, frequent bone density scans, stress tests without symptoms, and colonoscopies after 85, these are all areas where the evidence suggests we're probably doing too much in too many people. But you and your doctor need to make individual decisions based on your unique situation. That's what good medicine looks like. Thank you so much for watching. I hope this information empowers you to have better conversations with your healthcare providers. Remember, you're in charge of your health, and asking questions is not only your right, it's your responsibility. Take care, stay informed, and I'll see you in the next video. And someone wants to do a test just because you're due for it, or just because it's been a year, pause and ask those important questions I mentioned earlier.